You can look at the camera just for reference if you'd like.
Did you couldn't get that thing hooked up?
Facebook is live, I see that.
Hey Laura,
I see that.
Hey Laura, we took our TikTok and do it before. Yeah, I mean, not for the weekend. They're only there while we're here, but they get bored, which, you know, they would probably like that.
1 minute left.
Letting me share. Wait, she'll share. So it's not letting me share anywhere. So,
I don't know how to do it.
You're on Facebook, right?
Yeah.
Yeah. You should be able to just pull up on someone else's phone and share.
We're
Because
gonna be
it's
going live
definitely
in a
live.
few minutes. Getting started.
Got 4 people on our YouTube.
Hey, go sit down.
Saying no audio.
Yeah, we're on mute. We're on mute right
Yeah,
now.
we're all muted. Let's actually I'm gonna unmute us for 1 second just so you can do a mic check.
I'm not muted.
Oh, okay. Hello, can y'all hear me?
You know, here, Dalton. On my screen. On my people.
Yeah, yeah. Yeah, yeah.
Hey, Dalton, can you say like testing over there?
Testing.
Do y'all hear him? Let me know. Y'all on. Hey Laura, can you turn that up and go in another room and see if you can hear Dalton when he says testing?
Nope, but I put my headphones in.
You're one of the people that's on here.
Ah, smart.
Now, which one? Which social media?
TikTok.
Hold on a second.
Say testing.
Testing.
Say Nadia, can you hear me?
Nadia, can you hear me?
Could you hear Laura?
Now you're both just fine.
Ready to get started.
We need to know if y'all can hear or not. Can somebody check our TikTok and let us know if you can hear? How can y'all?
Oh,
They're
I
right
think
in this
Laura
room.
did.
They're
That's
right
what
in the room.
that's what she just checked TikTok, and she said she can hear.
Oh, okay. I didn't
Okay.
hear her.
Can you go on Facebook and check the one?
All right. I know I'm deaf. Well, maybe not all of them.
I'm the middle person.
Actually,
Hello, testing. Testing.
Oh, Facebook's on mute right now.
Oh,
That's why I'm not hearing it.
no, I unmuted.
It's showing muted.
That's weird. What about now? I just turn it off, turn it back on.
Try saying something. Don't
Testing.
got that icon.
I'm gonna have to restart it, probably.
Oh, the mute button's gone. It's working now. Oh, did you just exit? Oh,
Yeah.
no. I think there's just a delay.
That went away and now it's not really
Probably.
obnoxious. Is the front door locked?
Yes.
was.
Should be.
I don't know if it is now. I don't think anybody else is coming.
So muted.
I shared the Facebook to like 20 people.
Ooh, y'all even gave me
I
a
shared the
pillow.
TikTok
I
live
feel
to
half a
Just News.
We so muted on YouTube.
Yes.
Look,
Okay, I'm trying to get on
Stephanie,
Facebook.
have you ever noticed that we have the exact same phone?
No, because we never had our cases off.
That's so crazy. Peanut butter and jelly.
I shared the TikTok one under Business News again.
Will you go
Make
look
sure
at
you notify
TikTok
us
real
when
quick,
you're gonna
Stephanie, and
start
make
so
sure
we
that,
can
will you go
unmute
check
it.
the TikTok, make sure that's still like going good? Everything's like lined up still and
Yeah.
If you all want, you can have someone just like Ian and Vinny are doing in there, monitoring it with sound and everything.
okay. Yeah, Ian and Benny, if something bad happens,
He can just come here.
alert us.
So they're
We have a
monitoring
pre-
it
Oh,
too.
Yeah, we have a production team in another room.
All right, we ready to start?
Yeah.
I'm gonna unmute you two.
3, 2, 1. Hello, fellow workers. My name is Dolan Nolan. I'm an organizer with the Louisville Workers Brigade, a workers association that's dedicated to supporting, educating, and uniting working people in the Louisville community. Thanks for joining us for our first live streaming event.
I'm Destiny with the Revolution. We're live on TikTok, Facebook, and YouTube. So if you're having trouble with your stream, you can find us somewhere else.
Absolutely.
But yeah, we're a grassroots C4 that works in rural Kentucky, and we are trying to bridge some of the divide between rural Kentuckians and their issues with healthcare and in the cities. And we're all experiencing the same thing, so that we hope that by coming together and having this conversation and allowing others to come into the space that may have different views about other things, that we can find commonality and we can learn how to go from here, because coming up we will have an education session.
Absolutely. As working class organizations, we're dedicated, both of us are dedicated to fighting for and supporting working class interests, one of them being healthcare. Healthcare in the United States is, as most people are aware, abysmal. Can't get denied coverage on a daily basis, can't get access to the resources that you need, and even if you can get access to it, it is extremely costly. As a result, we believe it's necessary to talk about this issue of healthcare because of the issue of needing to talk about the importance of universal healthcare to address many of these changes we have. This live streaming event today is going to be focused on just a few examples and stories from people both within the healthcare industry working it and those who have experience trying to get access through the healthcare industry, and talking about how those experiences demonstrate how the U.S. healthcare system is not for working people and how we need to have drastic changes in order to lead to a better quality of life for all working and oppressed people.
Right. And if there's a lot of Americans that have recently come to realize that in other countries they have good health care and they are not suffering under a for-profit system. We have seen a place where there is something different with our own eyes now, and it's important that we make the change in America too.
Absolutely. To get started, we're going to start with an anonymous testimony from someone who has worked in the healthcare industry to explain how the cost that we see is demonstrated because of the issues of the companies focusing too much on profits and not on what is necessary. To begin, I feel as though I have reached a point in my life that I have seen the medical system as a force of healing and as a siphon of wealth. As a child, I was rarely sick, but on the occasions that I did, the doctor could see me in a couple days. My father boasted a few times that he only had to worry about a $10 copay. Generally, these visits consisted of physicals, blood testing, and the annual strep throat. To my knowledge, the insurance that my father got through his job had us covered and kept the cost of such visits low, if anything at all, past the copay. When we lost that insurance and began to rely on my mother's, the boasting stopped, but it was still quite manageable. By the time I got to college, it was about $100 to go visit the doctor's office, so I began to avoid going when possible. When I began to work and pay for my own insurance, I have to note that the doctors I chose for my care were not in network anymore, so the cost of each visit was now closer to $300 before tests and medications. I now do my best to not think about getting sick and what that may mean for me. This, mind you, is with health coverage I got from a hospital job. Of the fields of professions, one would think that the health insurance for a hospital worker would be rock solid. Insurance.
Go ahead. Go ahead.
Also from the sense I was on. Of the fields of profession, one would think that the health insurance for a hospital worker would be rock solid insurance capable of letting yourself get looked at if you were having a persistent cough or stuffy nose. If only to rule out something infectious, but I often found myself using accrued vacation time instead and hoped that I felt better quickly. Because it was going to cost about $5,000 before insurance would start covering doctor's visits in a meaningful way. Having worked on medical equipment and knowing the cost of maintaining and repairing them, I can see where a lot of money the hospitals charge go. As a biomed, I can say that my leadership couldn't care less that I was spending until I got about $2,000 mark. Even then, it was often second guessed. At about the 10,000s, in where at least a couple of days of consideration is given, looking at these devices, I can tell that items are not particularly expensive to make. An example of this is that a special incubator for a research lab that costs thousands of dollars is only a slightly modified fridge with a heater and a fan slapped onto the back. The parts for which could be cannibalized from a $30 heater from Walmart and a $126 mini fridge. Aside from extra time given to quality control, some items are no different from a kitchen appliance in terms of cost to build, maintain, operate, and repair. Yet they justify these costs because they put a guarantee on it and accept legal responsibility if a machine fails to use and getting FDA approval. A little alarm box that uses disposable sensor pads costs about $115. Best part is if it breaks, you can forget about fixing it because good luck getting that case sealed back up when the case is plastic welded together. Plenty of equipment in the hospitals are shifting in the direction of expensive to buy, repair, and replace. Make no mistake, this is only a small part of it, but not something to be ignored. Speaking of costs, I can say that there is a toll paid by most that work in the hospital. When I first started working at the hospital, I was able to take things one day at a time. This is not the case for nursing and their direct support staff. They often have to look after a dozen patients during a shift, and not to mention if someone is late or sick. Gaps in care is not something that can be allowed, but staff are stretched thin. Going around to most departments, I can say that parts that run around the clock had nurses and support staff that are drained of all vitality to the point that many are not able to continue or develop prickly attitudes. As one nurse put it, second shift nurses are feral. I had left my position as biomed shortly after a third-party member of management called me into his office. I was presented with no less than 3 written warnings and him pressuring me to quit, all warnings occurring over the course of 2 days, to which I can say were filled by panic attacks and aggressive overwhelm. In truth, I felt these issues coming in the form of panic attacks over the course of 6 months, but was able to hold out because that the team dynamic that was in the shop. The dynamic in the department dissolved over those 6 long months because of rapid changes in how we tracked our work, received requests from staff, and our coverage zones. Never once were we consulted on what it would mean to make these changes. I cannot say for certain that the changes made and how they went about making them were intended to set us up to fail, but by the end of my time there, I would be surprised if I wasn't the truth. These changes, in my opinion, ultimately will cost the hospital more money in the long run as they charge for nearly everything they do. Manufacturers of medical equipment have another thing they like to do to equipment to stop companies to stop making repair parts that hospitals are legally limited to buy to repair their equipment. This can force hospitals to buy new equipment and that does the same things but only with a couple extra bells and whistles to charge higher prices. This all boils down to higher prices on patient care and higher hospital bills. To round this all off, I do not believe that going to a universal healthcare system is enough to fix everything wrong with the healthcare system. There's likely a need to restructure hospitals and doctors' offices themselves to have the staff needed to provide the quality of care needed in such a critical sector of our nation's health without causing caregivers to become so drained we are. Moving to a universal healthcare system, I believe, is a good first step. This may allow general practitioners to pursue the tests and treatments they believe are needed versus what some faceless corporate body that is incentivized to prevent certain cases routes and push others that may or may not be as effective. Putting the decision of medical necessity back into the hands of educated doctors and their patients could go a long way towards a preventative care and improved overall health and lessen the need for fully equipped hospitals. The less hospitals needed, the more likely existing staff can be consolidated into a small facility with less working hours and more time to recover mentally and spiritually. Unfortunately, this may not address the excessive costs of medical equipment modern hospitals rely on, but I am hopeful that this one step in the right direction will continue to domino to a better healthcare system. And with that, I think that statement really touches upon a lot of elements that we see. Obviously, the statement talked about the cost of healthcare, but first talked about how even with the insurance they were getting through their hospital job, they weren't able to pay the most basic of necessities, to where they were relying on their accrued vacation time, something that's to be used for their own personal time, to basically take off so that way they can stay at home and feel better. That's ridiculous. And to go further, talking about the issue of you have this equipment that's highly expensive that really, as they pointed out, shouldn't be.
Yeah, that's exactly what spoke to me when you started talking about the equipment. It's the same way with cars, appliances for our homes. Everything
Absolutely.
is there's you can only do it this way, and this is the price of it. Pay it or do without. And that's the same with healthcare. But healthcare isn't a blender or a coffee maker or a Nissan Altima. It's literally your life on the line, and they're saying, do it this way or do it without, do without. So I think a lot of people have done without so long that our health is in really bad shape. We haven't taken care of our health, so we're just really in the ditch, and we don't have the choice to do this or do without because we've got to buy food,
And it's worse off with design obsolescence because that medical equipment is needed to keep you alive. But if you can't get the parts, you have to always then upgrade, which increases the cost and doesn't help anyone but the people who make the equipment to begin with.
Yeah.
What time is it right now?
I don't know.
147.
But next we have Dakota coming up, right?
Yep. All right, Dakota, you are up.
Dakota's on the screen up here. Steph
Yes.
might be able to zoom in a little bit for you all, but you should still be able to hear, so let us know if you can. Hey, Dakota. Take Dakota off mute.
Hello.
Hello.
My name's Dakota. I went to rehab in 2021. My medical horror story kind of began just from the idea of needing to go to rehab, and the algorithm latched onto that, and actually scammy rehabs in my Google forever now. It just continues to be on my Google anytime I look for any kind of medical treatment. But anyway, that's just the beginning. Just going to rehab is a very demeaning process on human psyche. They, strip all your clothes, all your possessions. You're on a locked unit, no phone calls, no contact with the outside world. And they get good where you get medically stabilized. And then from there you go, if you continue treatment, you go into a locked unit for up to a month, where there are nurses, staff and stuff, but it's you're in basically a hospital for a full month, doing AA, and not a lot of. I didn't experience a lot of therapeutic resources there, even though it was supposed to be a dual diagnosis program. And anyway, I was on really good insurance. My parents' good insurance still, and so because of that, the rehab companies really wanted to milk me for all of my insurance money. So I was kept on the highest levels of care, which meant that I was in basically a locked unit or a locked group home, with checks every 30 minutes, no phone calls, no going outside, no, it was COVID, so no visitors, for 4.5 months. And although I voluntarily went into the program, once you're in the program, they use fear mongering and basically death threats to you that if you leave this program, you will die. And they use language like will, and it's like a determined thing. And it was really, really scary and demoralizing. It makes you question your reality. And I ended up being there for 8 months. And it was just very challenging. And there's basically no rehab work off the harm reduction model, only leaving the abstinence AA model, which can also be really negatively affecting people. I'm sorry, I'm just reading my email, trying to make sure I get through everything. But yeah, as an addict, like, you are treated like a second-class citizen, but in rehab, you're barely treated like you're human. You're really a walking dollar sign to these rehabs, and they want to make as much money off of you. I did a little research just in writing this story, and I realized that the rehab industry is a $35 billion a year industry, and it's expected to grow to $60 billion by 2029. So it's a very lucrative system, and it's designed to keep you coming back to the programs and not actually stay out of the programs. They want you to keep coming back and keep using and utilizing these resources, so you don't actually get better and you don't actually get help for if you're struggling with substance abuse, or maybe you were just having a mental health breakdown and substances were involved. Anyway, but yeah, I think that's my story. And I guess we can go to questions and discussion now.
Yeah, if you're in the stream, we have people monitoring the stream for questions, so feel free to ask questions of anyone that you see throughout the day. But one thing, Dakota, that I need to look at Dakota here. Hey, Dakota.
Sorry, I can't really hear you.
Which way do I need to point to here? One thing that I have noticed about the addiction and rehab industry is that it's also like predominantly religious based, and that we're also, funding these tax exempt organizations that are making the laws to make other aspects of healthcare illegal, like reproductive healthcare. So then we're also, kind of like doing bad, almost doing harm by sending people to rehab to find another healthcare problem. And yeah, I agree with the fact that it's become a for-profit system and an industry. And I believe that a lot of the C3 organizations that are more religious based see that as a way to make money as opposed to a way to help people.
I'd like to add on to that, Dakota. The situation, like you're telling the story about how they're, even with with your insurance, rather than that being something that's going to be a benefit, it becomes essentially a hindrance, because it's then the company itself is trying to milk you for all it's worth, and that just shows the rawness of the entire thing, because it's supposed to help you, supposed to assist you as it can, but instead they're treating you like a prisoner that is there to be a cash cow, and frankly that is horrific. And
I've recently learned about, in Florida, in Miami, you get into the system, almost in America, how you into the court system and you can't get out, but you go to rehab, and then when you get out, people kind of like target you. They pick you while you're in rehab. You get out, they get you into scam jobs because you need to have employment. Next thing you know, it's a cycle, and they send you to a specific rehab, And in that specific rehab, you kind of recruit more people, and they're creating an addict cycle where they're able to use them for scamming and finding more people to get addicted to feed the profit system. That's in Miami, but I'm sure that it happens here as well. So next up we have Robin,
No.
right? No?
Do you want to respond to any of that, Dakota?
Oh yeah, sure. Yeah, no, it's definitely designed to keep you ill. And I have heard that. I was very lucky that I went to. I'm here in Massachusetts. I'm in Massachusetts actually. And so I went to some of the better facilities. But they were still very religious and very AA focused. And the first thing you get to there, they're like, you need to submit your will to a higher power. It doesn't have to be God, but it has to be bigger than you. And so I am spiritual, but for people who are atheists, and it's very challenging and very demoralizing, and they do weaponize spirituality and Christianity for sake of their medical care. But I did want to talk about briefly about how AA was started by the people like Bill Wilson or whatever I think his name is. He went around to mental facilities where people were their most quote unquote these people they gave up hope on them essentially in the medical community. And so the AA people, the founding fathers, went to these medical facilities and abducted people. They were some of them against their will from these medical facilities and forced them to do the 12 steps. And apparently it worked for a couple of them, and now we have AA. But just how that came about is a lot of people don't know that.
Yeah, in America, I can see just it being a religious rehab would alienate a certain demographic of people that feel like they don't belong there, or
Dakota, this is Benjamin. I was the one that was corresponding with you on online, and I know when we had exchanged emails, I had shared a little bit about my experience that I went to treatment when I was it was right after my 19th birthday, and what you had talked about and what Destiny and Dalton have talked about is very similar to my experience. That especially in these for-profit, but even the non-profit rehabilitation centers and detoxes and things, there is an incentive for people to get temporarily well, but not permanently well. Because obviously, if people were to get permanently well, if we had alternative systems to be able to deal with substance use and things like that, a lot of these places wouldn't need to exist anymore. And so my experience has been that there's this revolving door situation in a lot of these places, and it's by design a lot of times. And it's sad because we're playing with people's lives. I mean, I was in 12-step recovery for 6.5 years, and I probably buried 3-4 dozen people under the age of 30. I mean, and these are people that, like you had said, the 12 steps, which works for a lot of people, and I don't want to take that away. My grandfather got sober in AA in the 1950s, stayed sober for his life. Like, good on him. But for a lot of folks, this 12-step solution cannot work for them for one reason or another. It might be the spirituality side of things. It might be that, the strict dogmatic view of no cannabis or no alcohol, if maybe your substance of choice was something else, it just may not work for everyone. But because these facilities are forcing that issue and provide no other alternative, in fact, like you said, pose other alternatives as ways that you're going to die and you're going to relapse and da-da-da-da-da, what they're doing is they're creating a self-fulfilling prophecy. And a lot of these young people that I've sat in their funerals, I've given eulogies for, like, these people didn't have to be in this position. If they had systems of harm reduction and support and alternatives, there's a good chance that they would still be with us today.
Yeah, I have a lot of friends like that.
Would you?
Yeah, of course. I think there's being life-saving medicine that is being denied because of the culture and systems that
Yep, absolutely. Thank you for your time, Dakota. Thank you for sharing your story. I know it must have been very hard, but we appreciate it. And sure that our audience is very thankful to hear too, just to show that there are other people who have experienced something similar to them, and it makes them feel like they are welcome and they are understood.
Yeah, it's
Yes,
important
thank
to
you
feel
guys so much
seen.
for having me. I appreciate it.
Absolutely. Take care.
This plays perfectly into our next guest, which is Robin. Robin is an organizer for the Revolution. I'm going to give you my seat, but I'll let Robin tell you. Get out of here. Tell them all about your awesome stuff.
Okay. I'm Robin. I'm with the Revolution, and I am the field organizer for Shelbyville, and I'm also their outreach director for addiction. So I have helped several folks get out into recovery, and yeah, so we'll step into recovery first, and then I'm going to talk a little bit about some elder care for our elder support for what's going on there. So our addiction apart, I do feel like it's a bit challenging for us. My personal experience was with my very own son, who suffered addiction for about 11 years. He's been in recovery for, he just celebrated his 1 year. He has worked the 12 step, he's worked every program across the state of Kentucky and North Carolina. He did spiritual, he did facilities that were nonprofit, for profit, faith based, everyone. So, with that being said, I do feel like it's the person. I feel like it's the person. Like, what is the person? Where are they at in their time of addiction? What are they needing? Like, there's so many factors that pertain with what they're going to at that time. You know, I know we talked about is it the 12 steps? Is it the spirituality?
Tell them about how you used to view your son's addiction and needing
I was so
adoption versus how
I could
you changed your mind. About that.
so with me in the beginning, I was so angry with him in the beginning, because to me, I was thinking it was his choice. You know, why are you choosing to use? And like I said, you know, this went from him telling me in the beginning, you know, I got something to talk to you about. And I kept thinking the whole time he was going to tell me that he had somebody pregnant while he was off to college. So I kept thinking to myself, boy, he better tell me what's going on, because if he don't, this baby's going to be born, and I'm not going to know anything about it. So long story short, he comes and tells me I'm addicted. So when he told me that, I was like, I mean, I could have just sank where I was. I didn't know what to say. But at that time, 11 years ago, I was like, we're going to get through it. We're going to get through it. Never in a million years did I think it was going to be this hard, because it was. We started off the first treatment that we went to. There was a hospital at Norton Audubon. They had contracted out beds that our insurance at that time, when he got his assessment, did not pay. So now we're going to go into a little bit of the healthcare part of it. So the insurance at that time didn't pay for him to go anywhere long term. So it cost us $4,000 pocket to stay 5 days to detox him. That was our first round there. And I said, okay, so we took out a loan because they said, give us the $4,000, we'll detox him up front. And I was thinking that was going to be his cure. And I was thinking that was going to be his cure as the mother. Okay, we'll pay for his detox. Because at first I was very angry and I said, well, if we get through this first detox, he's not going to be sick anymore and he'll never want to turn back. He'll never want to go through this again. So I was wanting to do everything in my power as I could as a mother to do it. So if it was for me to go get a loan, that's what I was going to do. So we went and got that loan. And he sat on a bed that was contracted out through. It was just a scattered bed at Norton Hospital. Got detoxed. As soon as he was released, he went and used. So then I was angry, and it took up until about probably 2 years ago. I met with a counselor that he was seeing at a facility that's the medication assisted facility that's he's getting treatment from not the Suboxone but the methadone clinic. I met with her and I said, please don't take that route. You're substituting one for the other. And she met with me and said, sometimes you have to meet them where they are. And I was so upset that he was still using, because in my mind, I was saying he was substituting one drug for the next. And I just could not prepare myself that my son was going to die. So I met with his counselor and she said, his insurance at the time he had Medicaid was going to pay for it. I met with her and she said, meet him where he is in his addiction. And that's where he was. He needed to use safely at the clinic and see them. Since he's been going there, this is his way to get himself clean. So that's when I started to see a counselor myself to try to help myself to understand his addiction, to try to meet him where he was. So I understood it better. And he's sober. I started talking to Destiny, and I wanted to give back because I have done CPR on my own son, and not many other mothers are that fortunate to still have their child alive. He's 31. He has 4 children. He's married, and that to me is a blessing. And he does work the 12 steps. He does have a sponsor, and he does know, he acknowledges, every day he lives his life as an addict. He puts in his work. He knows how important that is. So I do feel like it's, each person is different. So I think it's just what's best for each person, what they're going through at the time, what drug of choice, what if it's alcohol, whatever the situation may be. Off to elder care. I have worked in healthcare for 28 years. And I can say that my part in healthcare is I've seen a lot. Post COVID, we're worn out. I feel like the state is allowing us to work with bare minimal, and I feel like that there is no staffing ratios anymore. I feel like that reflects on patient care. I feel like that reflects on skin breakdown. As a whole, I feel like it's about, at the end of the day, it's about making more money because we can have less to make more. And in the state of Kentucky's eyes, it's okay because they've been allowed to do it and nothing's being done about it. And our healthcare workers are, we don't get the proper breaks that we need. We work 12, 14, 16. I just pull a 28-hour shift during our snowstorm. I would do it again because people have to be cared for. Our elderly go into these facilities. They work their whole entire life. If they have a farm and if it's not been out of their name in previous 5 years that they've gone into the facility, if the family hasn't taken care of that and it's still in their name, guess who's going to get it? That facility. That facility is going to have it. So if whatever you have earned your whole life for, and you've worked your whole entire life for, if it's not gone within the 5 years, and that's so sad to me too. Like, I feel like, we've worked our whole life. Now you get sick, you have to have some sort of therapy, and then your therapy turns into, now you've got this pneumonia, you've gotten weaker, and then the facility saying, oh, well, let's keep you here a little longer. And now the staff is saying, oh, well, they really should be here. They meet criteria to be here long term because they're incontinent. Well, are they incontinent because you didn't get to them properly in a timely manner? Or are they incontinent because they're incontinent? It could just be they're incontinent because we didn't get to them in a timely manner. But we're coding them that they're incontinent because they're just incontinent. But it's just, it doesn't make any sense. It just doesn't. So now the family's faced with, oh, well, we got this farm over here, so we're going to lose it all because it's been in their name it's not been out of their name for 5 years. And it's just, to me, that just is so sad.
I think honestly your story just shows like how all of it's disconnected. You're talking about
Yeah.
how your son was needing that, assistance,
Yes.
but for them to have several days to be in that facility, it would for long term it would be $4,000, $5,000, and yet they're saying it's his fault that he's not that he's not getting off these substances,
Yes.
and it just shows you that like if there's no mechanisms in place to assist for that, to allow for ease of access to these facilities, then then how can you say it's their fault? Same thing when it comes to the elderly. When they need assistance, they're not given that assistance because the society either sees them as money bags or as not worth anything.
That's right. That's right.
I want to say thank you for sharing your story,
Thank
and
you.
thank you for. I hope your son continues on his journey, and
Thank you.
just thank you for sharing.
Thank you so much.
So,
Thank you.
all right. Next on our listing, we have Violet, who will be talking about rural healthcare in the United States.
Not knock everything over
No
because I'm a
worries.
huge klutz.
And
You can just use that.
You can use
No,
that
we're
chair,
gonna
that's
sit here.
fine, yes. Just scoot in if you need to make sure the camera sees you.
I'm too clunky.
You had to go under the wire. Go under the wire.
Oh, please don't.
Sit in the chair. It's on the other side of the
Yeah.
wire.
Let's just move it.
You're asking a lot of me and my hips to get through that
We
wire.
can just move it.
Yeah, let's just use that.
You come this way.
Yeah. I'll just push over here.
Dalton, you sit there.
Yes, I'll do this.
We can get that angle.
Okay, is that better? Alright. Hey y'all. My name is Violet Olds. I currently live in Brooks in Bullitt County, Kentucky. I've also spent time living in New York and West Virginia while having been born and raised in Florida. When you think of some of these states, you think about cities and vast metropolitan areas, but they're also diverse with rich rural areas ripe with history, not unlike here in Kentucky. I come to you tonight as a mother, as a daughter, as a sister, and a woman who knows what it's like to feel the weight of the struggle. We live in a place where land is beautiful but hard, where our communities are tight-knit but often forgotten, and where the struggles we face feel as unyielding as the Appalachian hills themselves. And now, with the overturning of Roe versus Wade, another burden has been added to our shoulders. But let me tell you something. There is hope in this struggle. There is a power in knowing that when you leave us behind, we've always found ways to rise up. But we can't rise up if we don't talk about what's really happening here in Kentucky. We're a state of small towns and back roads, coal camps and haulers, where so many people are just trying to make it through the day. And places like Breathitt County, where nearly 40% of the people live below the poverty line, or Clay County, where it's even higher, the challenges feel endless. Jobs are scarce, hospitals are closing, and too often we're left fighting the same battles our grandparents fought, just to survive. For women in rural Kentucky, the stakes are even higher. Nearly half of our counties are maternity care deserts, places where there's no hospital or an OBGYN, no midwives, no prenatal care. What do we tell the pregnant woman who's in labor at midnight, 90 minutes from the nearest hospital? What do we tell the teenage girl who finds herself pregnant and has no one to turn to? And what happens when that woman is forced to carry her pregnancy to term, knowing she can barely afford to feed the children she already has? This isn't just about healthcare. It's about poverty. It's about inequality. It's about a system that has failed us for generations. Let me give you some numbers that should stop and make us all think. Kentucky's moral maternity rate is 40.8 deaths per 100,000 live births, one of the highest in the nation. For Black women, it's even worse. Nationwide, Black mothers die at rates 3 times higher than white mothers. That's not just a statistic. It's a death sentence written by our broken system. In counties like Wolf and Owsley, Over 30% of the residents don't have reliable transportation. What does that mean for a woman who needs prenatal care or emergency services? It means she's stuck, and the consequences of that can be deadly. Rural hospitals are closing at an alarming rate. Over 180 have shut down since 2005 across our nation. When they go, so do the maternity wards, and so does the care that we depend on. These aren't just numbers. These are the stories of women we know. Women who work 2 jobs and still can't make rent. Women who have buried their own children because they couldn't get the care that they needed. Women who are doing everything right and still falling through the cracks. But here's where we find hope. There's a solution that can change all of this, one that politicians on both sides of the aisle have ignored for too long. That's Medicare for all. Think about it what it means for our communities if every single person, every mother, every child, every worker had access to health care, no matter where they live or how much money they make. Medicare for all would ensure that no woman in Kentucky would have to go without prenatal care because she can't afford it. It would save rural hospitals from closing because they wouldn't be bleeding money trying to provide care to uninsured patients. In fact, studies show that universal health care could stabilize rural hospitals and keep them open for the people who need them the most. It would mean that a mother in Harlan County who makes $25,000 a year wouldn't have to choose between paying for her child's asthma medication and putting food on the table. Medicare for all isn't just a policy. It's a promise that no one in this country will be left behind because of where they were born or how much they earn. And for rural Kentucky, it would be a lifeline. But here's another truth. Neither political party is fighting for it. The Republicans who claim to value family values have gutted the systems that would actually support families. The Democrats who talk about healthcare as a human right can't seem to muster the political will to fight for it. Both parties have turned rural Kentucky into a political afterthought. But we are not afterthoughts. We are the backbone of this state. We are the ones who dig the coal, who grow the crops, who raise the kids and keeps the light on. And we deserve better. So what do? First, we demand real investment in our communities. Expanding Medicaid has already saved lives here in Kentucky, but it's not enough. We need Medicare for all to ensure that every single person has access to care. Second, we fight for infrastructure that supports us. Broadband isn't a luxury, it's a lifeline. With things like telehealth, even the most remote communities can access prenatal care and mental health support. Expanding rural broadband is one of the simplest and most effective ways to save lives, and it's long past the time that we get that done. Third, we build systems that reflect our values. Programs like the Kentucky program HANDS, which provides home visits and help to new moms, are already making a difference. Let's expand them. Let's create community networks where neighbors help neighbors. Let's stop waiting for someone else to solve our problems and start solving them ourselves. But we also have to recognize that this is more than about healthcare. It's about power. Reproductive care isn't just a health issue. It's a liberation issue. When a woman can't decide whether or not to bring a child into this world, she is not free. When she's forced into poverty because she doesn't have access to health care or paid leave, she is not free. And if we believe in freedom, real freedom, we have to fight for systems that give every woman the power to shape her own life. And for those of us who draw strength from faith, like myself, let me remind you, every great spiritual tradition calls on us to fight for justice. Christianity, Jesus stood with the poor and the oppressed. In Islam, justice is a central pillar of the faith. In Judaism, the Torah calls us to care for the widow, the orphan, and the stranger. No matter your faith, or no faith at all, the message is clear. We are called to stand up for those who cannot stand up for themselves. Friends, the struggle here in Kentucky is real, but so is our resilience. We face floods and tornadoes and mine closures and factory closures, poverty and addiction, and yet we're still here. And if we could survive all of that, we could survive this. So let's fight, not just for ourselves, but for our daughters, for our neighbors, and for our communities. Let's build a Kentucky where no woman has to choose between her health and her future. Let's create a world where liberation isn't just a dream, it's a reality that we build together. Thank you, and never give up hope.
Thank you so much for that story. Honestly, you hit the nail on the coffin. I mean, when you look at the situation in rural Kentucky, they're at a disadvantage. Every rural working person is at a disadvantage because, as you said, hospitals are closing at an alarming rate, and yet how are they supposed to get the care they need if there's no hospitals? How are they supposed to get access to all the things that are in the cities in abundance? Like in Louisville, I can go 5 miles or 10 miles and get a hospital, but if I'm outside of Louisville, I have to drive tens, if not dozens of miles to get to the nearest hospital. And that, as you said, that's not freedom.
Right.
It's a lie.
And it's not just maternity care, which is what I chose to kind of focus on. It's mental health care. It's for people
100%.
who have disabilities. It's occupational therapy. It's mental health therapy. It's substance abuse therapy. It's physical therapy. It's cancer.
doctor,
Heart-
lung doctor,
right,
brain,
cancer
any kind of
doctors.
specialist
Like,
at all.
I had to go to the Brown Cancer Center at U of L to receive some infusions for not cancer, but I was in there and I was listening to some of the seniors that were in there who had to travel ridiculous distances and have never driven in the city before and had to navigate downtown Louisville in order to receive cancer care, and that's not equitable, and I don't believe that's just. And I'm a little bit different where I believe that my faith a lot of times informs my politics, but as a progressive Christian and a progressive person, I see that my faith calls me to help others, and that my faith helps me to help the poor and the downtrodden and the sick and those who cannot reach the doctors. And it is through my faith that powers me to create a more just and equitable society. And I think that's an important story to tell as well. Because you hear a lot about religion in the rural areas, but often it's very restrictive. But not here, not with me.
Nationalist, Christian nationalist. They
So-
don't also have
Yes, conservative Christian nationalism. I don't play that game.
I think you did a good job here of sharing your story and doing as your faith tells you to do.
Mhm.
So I thank you for sharing your story and telling our audience what it's like living in rural Kentucky. And thank you so much.
You're welcome. Okay, everybody.
Absolutely. Our next speaker is someone who is not going to be in person, but a pre-recorded video of a friend of the brigade, Colin McIntyre, who was previously in jail for a few months. And in this video recording, he has done an interview. He's going to be talking about his experiences with healthcare in the jails.
Another for-profit
All right, could you
system.
talk about the health care or lack of health care in jails and prisons here in Kentucky?
My experience with healthcare inside of jails has been pretty terrible. I've had some ongoing teeth issues for the last probably 5 or 6 years, and when I was incarcerated, it seemed like every bump, if I bump into a wall, my whole face would swell up to the size of a grapefruit. And they are very apt to pull your teeth for free, right? And but you have to wait on this 3-month long waiting list. And so my experience with this is I have a hole in my molar, and I decided that instead of getting it removed and then having to have cosmetic surgery to get a new tooth put in, which would cost thousands of dollars, right? I figured it would be cheaper to just deal with the problem, take antibiotics in case it's infected, and move on from the subject and get it fixed when I got out, because I'm not going to be there forever, obviously. And so the guy in jail comes up to me after I decide not to go to the doctor's appointment or the dentist appointment, and comes up to me in this fury, and it's just absolutely over the top, angry, just don't ask for nothing else ever again. I can't believe you did this. And I tried to explain to him, that it would be a better route for me financially to deal with this outside of here instead of removing my teeth, which is not what I wanted to do. And they were just not hearing that whatsoever. He was very angry. And then I had a following problem with a different tooth. And I went to the nurse, and the nurse rejected my claim on getting something like Tylenol for it because she didn't like the fact that I didn't go to the dentist to get my teeth removed. And basically, in her words, she said, well, don't ask me for anything if you are in pain in your jaw anymore because you didn't go get your tooth removed. That's stupid. And you're stupid for not getting your tooth removed, is basically what she said. And I tried to explain to her as well. I said, well, a cosmetic surgery of that nature, getting a tooth put into my head would be like $5,000 or $4,000. It shouldn't matter to you much whatsoever, but she was very rude and inconsiderate. And it just seemed like it was real hit or miss in there. Like if I needed something, it was very fall out, and they would just ignore them. Like, it was just absurd. Like, you basically had to be on death's door to get to a hospital in that place because they make money off you being there every day, and if you're not there, they can't make money off of you,
And you had to pay for Tylenol, too, didn't you?
Oh, yeah, I had to pay like $5 just to go see the nurse for Tylenol. And they give you some generic, $4 a bottle for 120 of them, and you're paying $5 for 3 sessions worth of Tylenol, and you can't have any more than that. If you ask for more Tylenol, you have to put in another medical request, which costs more money, and then it's another $5 for the Tylenol. So they rack up all this money on these pills, over-the-counter stuff. It's just absurd.
And then if you're feeling ill, like you've got this horrible toothache, did they still expect you to go into work in the kitchen if it was your shift?
Oh, yeah. So there was a point in time where my jaw was so swollen and hurt so bad that my face felt like it was breaking. Like it was so swollen. And so my face felt like it was breaking from the amount of pressure that was in my face. And they gave me a few days off at first. I look at my face, and like the first few days, they were like, no, you got to go to work 8 hours basically for free, and just deal with it. I mean, it was like, it felt like somebody was taking a knife and sticking it in my mouth. It hurt so bad, and I would have to take constant breaks, and they would yell at me for taking breaks.
And just to add for context, because we have a full interview with you that'll be coming out, next month in February, but for those that, obviously no one's had the opportunity to listen to that yet, you were working in the kitchen 8 hours a day, 5 days a week, for less than 70 cents a day, not an hour, but a day, correct?
Yes.
And so they're taking half of that, you said, for your rent for being incarcerated against your will. So you're really only getting about 30 some odd cents a day, and then whatever friends and family can send if they're able to put on your commissary, and then they're charging these ridiculous prices for not only, Tylenol and Listerine, just the basic, toiletries, but then also for if you wanted snacks or anything like that, they were charging that as well. Those crazy prices, correct?
Right. So if I wanted to enjoy normal toiletry things like toothpaste, like Colgate, and a bar of soap, or body wash, or conditioner for my hair, or shampoo, or things like that, by the time I was done buying that, I had no money to buy food. I had enough money to buy like 1 bag of coffee. But, most people in there don't even get that. They don't even get, that's not the first thing on their mind. They're starving to death because the trays are so small. Everything is so marked up in there, like, it's at least bare minimum everything is like 3 times to 4 times what it is on the commissary list versus, being out in public. But when you don't have any access to making money and you're completely dead broke and say your family doesn't have the money to give you anything, I mean, I've done a stint of time in jail with no money. And you have to, come up with ways to feed yourself with no money, like doing laundry, and, cleaning for other people, and doing strange, weird things to just try and get, enough money to get a ramen noodle or a cup of coffee or, you have to trade off certain things. It's just a weird bartering system that seems to go on inside of jail.
Well, thank you for sharing your experiences with the lack of health care and just the medical neglect that prisoners and inmates have to endure.
Absolutely.
Yeah, and at LMPD or LMDC downtown, I know we've done protests there. They've had a record-breaking number of deaths in the past couple of years, and you know, a lot of it, part of it's addiction related. A lot of it is lack of medical care inside the jail system at all.
Absolutely. We found that the ACLU found that one of the highest issues for death is neglect. And I mean, the prisons we hear from, the jails and prisons that Colin was talking about, they aren't about anything but just simply exploiting and brutalizing these people. So they have no interest in worry about their health. They're just worried about making money off them. And even with like when they're getting paid $50, every day, they don't even get to see that money until the end of the month. And here you have, but they're still taking that half of that to because like, oh, we need to make sure we're keeping that money for ourselves. And so it's not surprising that the healthcare in jails and prisons is abysmal. It's not even really healthcare because, as Tom pointed out, the first thing they wanted to do was not to see an actual dentist to address the issue. Like, no, just take the tooth out. And because they'd rather take the tooth out than have to actually spend the money to address the issue as a whole. And it's just horrific and just shows how healthcare plays into the prison industrial complex.
And with addicts, when addicts are arrested, withdrawals can kill you. Locking you into a solitary room does not address the medical need that you have. And, you can die from withdrawals by just getting arrested, but in jail and still around a couple days. But next up, we're going to have Angie come and talk about maternal health care. So, a little bit off topic. I'll give Angie my seat right here. I'll give. I need to change. I'm going to put the microphone on you and put the charger on.
All right. Well, I'm Angie. Just a little bit about me. I grew up in Kentucky, and I would say I grew up quite poor in Kentucky. And I'm also currently a midwife. I've been a midwife since 2009. Mostly I've worked in Oregon, and I've been back working in Kentucky for the last 3 years. And one thing that I want to say is that and there's a lot of reasons for that, and it would take me a long time to go into all that. But what I can tell you is that we all share one thing in common. We are all born. And we know there's so much evidence to show that the kind of experience that a woman has when she's pregnant affects her child for the rest of their lives. If she's under tremendous stress, then that baby has effects in their life from that. And unfortunately, that makes a lot of moms feel guilty, and I'm a mom. But the reason I wanted to bring that up is that you would think, because we know that we would create a healthcare system and communities that actually value and support pregnant women and keep them safe and keep them healthy and vibrant. We know that Kentucky has a high rate of maternal death, and the 3 most common things that cause women who are pregnant or postpartum in Kentucky to die is intimate partner violence, substance use disorder, and mental health disorders. Those are the top 3 things. Those are all things that are healthcare crises, but also community crises that we as neighbors, as friends, that we can jump in and provide support and help change those outcomes. But when we look at the maternity care system itself, as Violet mentioned, we have a situation in Kentucky where half of the Kentucky counties have nobody to provide care for them. So when I was working at an academic medical center here in Kentucky, I would say the majority of my patients were driving at least an hour to get to care. they were, bringing their children with them or getting daycare for their kids so they could come to this 15-minute prenatal visit. And if we kept them waiting in the lobby for an hour because we were running behind, that's okay. But if they're 10 or 15 minutes late, their appointment's canceled. I just think that's a crime. It should not happen. If somebody shows up for care, they should get care. And there are some great models out there that really do prioritize easy access to care, because that is a way, if we could just get people into visits when they do show up, we could prevent some poor outcomes. We also see in Kentucky and nationwide that we have high rates of cesareans. That also plays into that the risk of maternal mortality or morbidity, like maternal illnesses are caused from people having unnecessary procedures. We also, to go back to Colin's point about jail, I've taken care of a lot of women who are in jail while they're pregnant, or also women with substance use disorder while they're pregnant. And what I've noticed is that overall in our healthcare system, that if somebody has a stigma related to them, whether it's poverty, whether it's being an addict, whether it is having been in jail, then their health and their child even is not as valuable, it seems like, as other people's. And so those are things that I think, looking at the overall model of healthcare, and I want to just really quickly go back to a history lesson in Kentucky. If we go back to the 1920s in Kentucky, in a lot of these counties that Violet mentioned, like Owsley County and Leslie County, Clay County, they had midwives in those communities who helped take care of people. And what I read, what shocked me, was that for every one OBGYN or one doctor at the time, because they were probably more likely family practice doctors, there were 14 midwives in those counties taking care of them. Meaning that there was so many people there available to give care. And it doesn't look like the midwifery model we have today, but I do think there's a room to think about it. And when they interviewed some of the family members of those midwives who are still living, they said that their moms didn't think of themselves as midwives. They thought of themselves as neighbors and there to provide aid for their neighbors. So anyway, I don't know what a new model would look like, but I think the model we have is not working, and we need to make some big changes.
Absolutely. And to kind of go back to the point of that was been mentioned before, is the idea of choice and freedom. Throughout all these conversations we've had with each of the speakers, there are systems in place that do not allow for a person to be able to make the choice they need for their own benefit, for the benefit of their family and choice they need for their own benefit, for the benefit of their family and friends. You have, they want the best for their children, but if they can't get that, then that affects the child and they feel shame for it. Even though that is not their fault, it's systems in place. And we see that, as you point out, 1920s, they had all these different, midwives to 14 for each doctor. It's like, that would go a long way to today of addressing all these problems, because the big issue is staffing.
Yeah.
If you don't have the staffing, you are getting people who are getting worse care because the people they are seeing to get that care are stretched so thin.
Yeah.
And then that being stretched thin causes the stress for them, and
Totally.
it's a situation where so much of it is dictated by systems that we have no control over.
Yeah, yeah. And I do think that's what we're seeing with these hospitals closing down. In my experience, I've worked at small rural hospitals, big academic, facilities, and also home and birth centers to provide care as a midwife. And in all those rural settings, what I've really noticed is that people, you can't get the people to be in the community to work. So a lot of the medical schools are in bigger cities, and then once people are trained, they see, some luxury or so forth of living in a big city. It's hard to get them to go and live in these smaller communities. So what we need to do is train people who are already there in the communities and love their communities and want to be able to provide care.
Absolutely, that's the thing. It's the disadvantage of it just reinforces the cycle. And I think trying to change the way we frame and we go about doing healthcare in America can really make a big difference. Thank you again for sharing your story, and thank you.
Thanks for having me.
Absolutely.
He's on the call. If you can do her next,
Yeah. So next person on for our speaker list is that of Kay Tillow, who is an organizer with the Kentuckians for Single Payer Healthcare, who is all about, obviously as the name implies, getting healthcare in the United States under single payer. Before we have her speak, we actually have a little clip here that we want to show to demonstrate what Kay is all about.
Okay, we're gonna show a quick preview clip to introduce you, and then you'll be right on.
Everyone, except the super wealthy, would pay less for health care under a single payer system. The whole idea that the American people are all so backward and hate everybody else and don't want that is not true. The vast majority of people want everyone to have care. And we have majorities that are for an improved Medicare for all. So that's going very well. What is not going well is that Congress is not responding to this massive public sentiment.
But it is not easy to get a real good reform. So it's going to take activism by everybody in your audience, and many people have we can bring into this fight.
This issue touches the hearts, and we can win on this battle. We are now all in the same boat. Those who have no coverage, those who have coverage, those who are poorly covered, those who are at risk of losing their coverage, it really is our time to move this movement forward.
And with that, Kay Tillow, you're up.
Thank you. I'm very happy to be here with you.
Recording is on.
We here in the United States have a failing healthcare system. It fails workers, it fails patients. It's not working to keep people healthy. It costs double per capita what healthcare costs in other comparable wealthy countries, and it leaves us at the bottom in terms of the outcomes, which is what is really important. It leaves us 55th in life expectancy. All those who claim we're number one, nowhere near. This is a failed outcome for our healthcare system. The United States is at the bottom in maternal mortality rates and not doing well in infant mortality rates. The U.S. is at the bottom in lives lost to conditions amenable to healthcare treatment. That means, there are some conditions that we still haven't learned how to cure, but in the conditions that we know how to treat and where people get well, we have people dying from those at rates greater than in the comparable countries. Over 1 million of us in the United States have medical debt. About half go without needed care, seeing a doctor or going to the ER or taking a prescription because of cost. We lost more than 1 million people in the pandemic, and that was a rate that was much higher in relationship to our population than in other countries. We also have massive denials and delays of care by the insurance companies. We have hospitals failing. We expect that there are 700 rural hospitals at risk of closing. Large numbers of physicians and nurses are suffering from burnout and are considering leaving the profession. Our Medicare program, that's the program for seniors, those over 65, and those who are permanently and totally disabled. That is now more than 50% privatized in the hands of private companies that have the ability to deny care to the recipients. Medicare has it even higher. Medicaid, that's the program that covers those with disabilities in the state and those with very low incomes. And that's even more highly privatized, subjecting its participants to the barriers such as narrow networks, some doctors you can't see, some hospitals that are out of your network, etc. So for workers, employer-based health care was once considered the gold standard. In other words, it was pretty much the best that you could get, and people were pretty happy with it. It no longer is. Those companies and those insurance companies that control that employer-based care are now shifting the premiums, the co-pays, the deductibles to the workers. Average cost now of family coverage is now $32,000 annually. And the deductible, what you have to pay before you get care for a single worker under employer-based health care is approximately $1,700, more money than most workers have on hand to be able to do. A big problem with our healthcare system is that workers' healthcare plans are controlled by the companies for which they work, giving the employers a huge lever of control over the workers' ability to stand together and fight for better wages, benefits, and working conditions. A lockout or a strike results in the cutoff of health benefits, placing the whole struggle for something better into immediate jeopardy. So what's wrong with our healthcare system, and how do we fix it? What is wrong, briefly, is that the system is controlled by profit-making entities, insurance companies, pharmaceutical companies, private equity, and venture capital. Physician practices and hospitals are bought up by private equity with disastrous results, and the answer is very simple. We have to remove the profit makers from healthcare, publicly funding the system, cover everyone, remove the vast funds wasted on profits and the administrative practices that have been set up in order to reap those profits, and redirect those funds to improve coverage for everyone and to assure that everyone who is not covered also has coverage. We need to remove all of the barriers to care. We need a national single-payer healthcare system, free from profit, covering all, and with no payment at the point of service. And that must be done through the enactment of legislation that would accomplish it. It's fairly simple to do. It just takes the will. The last healthcare reform we had was the Affordable Care Act, and while it covered a few more through Medicaid, and it did cover some more in the exchanges, in other ways it made things worse by entrenching the power of the insurance industry, which collects huge subsidies, and their profits have gone way up since the passage of that law in 2010. So we have the problem that the mainstream academics and health policy experts in our country, most of them are under the thumb of the industry and refuse to acknowledge the need to shift direction. They assert the problem of high cost is because we're getting too much care, it's overuse, and they say the private companies are needed to squeeze out the unnecessary care, and they are wrong. We have to organize to use our power to promote the change to a national single payer or a national health service free from profit. And I would welcome your questions.
Okay, this is Benjamin. First of all, thank you so much for being here, and we're looking forward to your full educational presentation at the end of the month. On our YouTube channel, on the live stream,
a friend of the brigade and a good Teamster Union man is asking a question about, can you talk a little bit about, as he calls it, Medicare disadvantage and what that looks like?
What it's like? Yes, I can. Written into the law is a privatization of the traditional Medicare program. Medicare is funded publicly. You get it taken out of your paycheck. You and your employer pay, I think it's 1.45% out of every paycheck. That money funds Medicare, and the traditional Medicare is publicly funded with no one in the middle to say, no, you can't get that service. It directly pays the doctors and you get the care your doctor wants. Medicare Advantage is a privatization of that system, turning over to an insurance company an annual Medicare money, and then that company gets to decide what doctors you get to use, what hospitals you can use, and what procedures and treatments they will approve. It's a hugely profitable business. It costs the public about 22% more for each person in it, and yet the people in the program get less care and are met with roadblocks in terms of their ability to get the care. For instance, some of the best cancer centers, like MD Anderson or Sloan Kettering, or I think also Vanderbilt, don't accept Medicare Advantage plans because it pays lower. So it's a privatization of our health care, and unfortunately, employers have the ability to put people into that without their consent. So for instance, our retired teachers are in Medicare Advantage. Our retired state workers are in Medicare Advantage, and some workers in the private sector as well.
Absolutely. Thank you, Kay, for explaining Medicare Advantage to us, and thank you again for attending this, this live streaming event to give us a little preview about what your education is going to look like. Like it was said, like it was said before, on Wednesday 29th at 6:15 p.m. at the Highland Shelby Library, there will be an educational featuring Kay Tillow on this topic of healthcare in the working class, where she'll be going more in depth about this and about what working people can do in order to make healthcare in the United States far better. So again, Kay, thank you so much for attending, and have a good rest of your day.
Thanks. Glad to be with you.
Absolutely. Thank you.
Going to you, and then, like I said, skip me since we're a little bit over time.
All right. So next on the list of speakers is actually me. I wanted to talk a little bit about unions in healthcare. I am a rank and file member of Teamsters Local 89 here in Louisville. I work at UPS Worldport, and for most of my life, I was thankful that I didn't have to worry about coverage because I had pretty good coverage under my parents. I didn't start actually having my own insurance until I started working at UPS, where I am now covered by TeamCare. Under TeamCare, obviously, we have great insurance, and it's been known and talked about, and it's especially when it comes to healthcare. And what I've mostly been using it for has been dental work. This dental work would have cost me far more money if I hadn't had TeamCare, but because I've had TeamCare, I've been able to pay very little out of pocket. For example, in one instance, I can remember I've maybe paid at most, like in one sitting, $150 for one thing, and that wasn't even like for the procedure, it was for something extra, like I think a varnish of some type. But if I didn't have that insurance, that would have been far more costly. To give you a more recent example of that, this past Monday I actually had gone to the dentist in order to do some more dental work, but also to schedule future appointments. I am scheduled to get 3 crowns done on my teeth. Now, crowns being simply those little covers that go over your tooth to act as a tooth in the event that, you know, the tooth has decayed so much that you need to have a cover for it. It's basically a protective measure to keep the tooth intact. Well, with that, with my going through the procedure and, you know, the cost of each crown being done, you know, in total would have costed me $433.20. A lot of money, but that is far less than what it would have costed me without insurance. If I did not have insurance, the quoted price for all 3 crowns would have been $5,792 exactly. That is for 3 crowns. 3 small, tiny little things going into my mouth, and which demonstrate just how broken the healthcare system is, where you have people spending thousands of dollars already for, you know, life-saving procedures and whatnot, or for medicine. For simply a crown that goes over your tooth, I'm paying nearly $2,000 per crown. Again, I'm thankful that I have this, have the team care, because I don't have to pay that $5,000 price tag. But that's an issue in itself. The Teamsters Health Insurance is an exception, not the norm in every union, let alone non-unionized workplaces. You know, we have that. Firstly, with my health care with the Teamsters, I now have to decide as a factor if I want to leave UPS or get a different job. Because healthcare is so costly and insurance rates are also just as costly, I have to take my healthcare at UPS with the Teamsters into consideration before I even decide if I'm going to go to another job, which means that I'm limited through what I can achieve and what job I actually want to work. Additionally, I'm forced to also this coverage is reserved for union membership, not for the wider public. You know, whether the health insurance is funded by a union or is a contractual obligation through a workplace contract, the right to health care shouldn't be an item that's reserved for unions in the workplace. Everyone should have a union, no question about that. But when you keep the idea of health care within a contractual obligation, you're taking in health care and pairing it with vacation time, something that can be clearly, compromised and talked about. You're putting in the same boat, but they're not the same boat. One obviously is, they're both very important, but healthcare has been stated is life and death for most people. So if you're trying to tie that into being the same as getting a few extra dollars in your paycheck or getting more overtime, you're forcing that item to remain a part of the contract process rather than having it be for everyone. Because if it's for everyone, there is no worry about having to fight to get healthcare on the contract. It's just a given. And so when you have when you have healthcare as this item, you're leaving it into individual levels through individual unions and workplaces, which leads to disparity in the coverage, leads to people who are non-unionized being left to be targeted by predatory health industries. And even if you do have, good healthcare through a union or workplace, here's the problem: is that, as it was mentioned before by Dakota, these places will love to milk you for all you're worth and may not even see you because they're trying to get as much money out of you. And if they can't get as much money out of you, that's going to be an issue for them. So really, when it comes down to it, the people should not be forced to decide if I want to have healthcare in a contract or I want more overtime. Healthcare should just be something that all people have, regardless if they're in a union or not. And so I believe that to rectify this situation, we have to have universal healthcare, because that removes the idea of healthcare coverage having to be a concern for the vast majority of Americans, and also allows for people within unions to then save their energy for other issues that are just as important, or if not even more important, when you're thinking about the localized workplaces.
Yeah. You mentioned the dentist too. In rural Kentucky, we don't have dentists in our town. So regular dental care when I was younger was not an actual thing. I take my kids to the dentist for regular dental care, but I would guarantee you that at least half of my town doesn't, because I drive my kids an hour and 10 minutes. Some people don't even get on the interstate from where I'm from. So basic care is never even considered for people that like basic care.
and with the non-unionized with places in the rural South sadly being more not likely to be unionized, that adds to the problem further, where if they don't have anyone to act as a bulwark, they're struggling even with that now.
Yeah. If you don't have access to dental care and then you need emergency dental care, you're really
Absolutely.
in a bad shape. Yeah.
Your Teamster brother that's on the YouTube stream rightly called your all's healthcare the Cadillac plan. And he also had a question for Kay about whether she's corresponded with Ralph Nader on the topic of Medicare for All. So we'll make sure to notate that for the educational at the end of the month.
Absolutely. And that fellow Teamster, he's right. I mean, like, it's known that throughout the city that Teamsters get good health care, but that shouldn't be the case. Everyone should be getting good health care, because that means that it also forces people to leave the jobs they want to work at to go to work at the Teamsters. Again, every place should have a union, but you should not be forced to decide do I have to force to stay and work for this company to get the health care, or do I want to go get what I want elsewhere?
Yeah, you should join a union because we shouldn't have to need unions, but we need unions.
We need unions.
Like, to survive. We shouldn't have to be demanding and building power for basic human rights, but that is the necessity, and that's where we're at.
Absolutely.
Evan's on the call.
So our next speaker is also he's going to be attending virtually. This is Evan. He has been working in the healthcare industry for a few years now, and he's going to talk about his experience as a healthcare worker in the United States.
Evan, I might need to get you unmuted here. Let's take a look here.
Please do that. Yeah, we got it. Okay.
Nope, you're unmuted. You're
Yeah,
good to
sure.
go, Evan. You're
You have
on.
to move the handle.
Oh, we can't hear you.
Can't hear you, Evan.
Let's see here. Evan, we can't hear you.
I don't think he can hear you either because he's still talking.
Evan, we can't hear you.
Show him a note.
We
Right
can't
now.
hear you.
Can we chat him?
We can't hear you, Evan.
It might be something with he doesn't have his microphone on.
Oh, I think I know why. Try now, Evan.
Can you hear me now?
Yep, we got it.
Nice.
Okay, cool. Well, I'll just start over. Hi, my name is Evan Muller, and I live and work in Louisville, Kentucky. I've lived in Kentucky for most of my life, and I currently work in the healthcare industry and have for the past half a decade. The field that I work in is, it goes by a few different names, but like the first person's statement who was read, I am a biomed. It is my job to maintain, repair, diagnose, deploy, test all of the medical equipment in a hospital or doctor's office or whatever. If I didn't do my job, then the nurses and doctors wouldn't have anything to do their jobs with. But my horror story from that comes from the inside because it happened to me and my fellow biomeds in a local hospital network. So a little bit of framing. Back in 2021, I started a new job with a large hospital network in the region. I was fairly new to the field. Luckily, during my externship when I was in school, I got to know a local department director. So I got a pretty good entry-level position. After I had been there just a couple months, they moved me to the largest hospital within the network because they realized that my skills were most needed there. And this was really great. I found camaraderie, I found kindness, I found understanding from the vast majority of my coworkers, from leadership. And this is something I'd never experienced at any job I'd had. Normally, all my oddities and quirks were just reasons to single me out for abuse. Here they were celebrated. I was given tasks that nobody else was suited for. I felt like I belonged, and that I looked forward to going to work every day. That was something I had never experienced. It was a wonderful feeling, and I wish that work could be that for most people. I got to help a lot of people. I got to teach people things. I got to learn about new things all the time, new pieces of equipment, new techniques, new modalities, because, you know, being on the cutting edge of stuff is exciting. My leadership was understanding about my disabilities, my limitations. They worked with me to make sure I could work comfortably and effectively. But this changed after about 4 years. There was a new member added to our department, a new role created. Is a man who had just gotten out of a postgraduate education. He got a PhD in something business. I mentally just categorize it as a PhD in humanity. From the very first virtual meeting that we had with him, something was off. He said he wasn't there to make any changes, and all I could think was, then why were you brought in? The lie was immediately almost revealed as a falsehood. He started implementing all sorts of radical changes to our environment, to our work structure, to the expectations of the employees. Over the course of that year, things continued to degrade. They got worse and worse. We lost good team members. The job that I used to love going into, that I looked forward to, became a source of dread. I was waking my wife up just screaming in my sleep from nightmares constantly. It got harder and harder to go into work, let alone do my job while there. And the culmination of this came about a year after this new guy was added to the department, when we came in on January 2nd, after we had January 1st off, and, you know, a pretty chill December with all the holidays. It was nice. January 2nd, we come in, there's a big department meeting called, and surprise, our beloved director, that guy who I got to know while I was still in school, had been let go. A whole bunch of new unfamiliar people in business suits were all there to tell us, you know, with big smiles on how wonderful all these new coming changes were going to be. And yeah, we fired your department director, but here's the replacement guy for the role that we just eliminated. But he's just going to be temporary, so don't worry about it. And there's going to be restructuring coming. And all of your leadership is being forcibly converted to an outside company. And all of you also have to reapply for your own jobs, but you're still going to have your current jobs. You're not going to be employees of this outside company. We just have to have you apply for them so that we can get you into the system to track all the work that you do. And yeah, this is all as horrible as it sounds. The next few months just got worse and worse. We absolutely hemorrhaged talent. People that I considered some of the best workers in the department, that I thought had like way more, grit's not really the right term, I guess, staying power, stick-to-itiveness. I thought I was having trouble hanging in there, and people that I thought would hang in there much longer than me left months before I did. It was awful. The demands kept piling up, the confusion got higher and higher, and I hit my limit when I was breaking down sobbing 3 out of 5 days out of a work week, as one of my coworkers was holding me as I was just sobbing and rocking back and forth from being completely overwhelmed. And I know that this pattern of behavior is not unique to healthcare. The same approach to bringing in an outsider with whatever credentials plays out across so many industries. I saw it previously when I worked for all sorts of different companies. And it always seems to be devastating. But when it's healthcare, when it's a job that is so critical to keeping people alive and healthy, when the cost of failure is literally death, why would you bring someone in who only views humans as data in a spreadsheet? The way that this man and this outside company behaved sickened me to my core. Every one of the people from this company that was brought in was just, I did my best to stay polite and professional, but the things that they came up with for small talk were just objectionable. Like driving through downtown Louisville like being in The Walking Dead, because they see people at their lowest points in their lives and just dehumanize them further. It seemed that a disregard for human dignity and decency was at the heart of that company, and I'm very glad that I got out. I have a new employer. It's another big local hospital network, and I'm not naming either of these companies that I work for, but at our new one, we have an on-site food pantry. During the daily safety huddles that we have every day, they mention how many neighbors we served the previous day in the food pantry. And these are people coming in and getting care, like in the emergency department, getting care in the clinic that's on site, or sometimes just coming in just to get some food and supplies and help. And I think it's important to surround yourself with people like that, people who care about others, not people who just view a stranger as another mark to be conned. And yeah, that's my experience.
I am so sorry you had to deal with all that, Evan. Like, it just sounds horrible. And to just hear from one of the suits saying, comparing downtown Louisville to The Walking Dead, it's horrible. And it really just goes to show like how these changes that the companies do when they bring someone in, how they affect people. And, you know, one of the things I was curious about is like, you know, as you and your fellow workers are trying to deal with all this, you know, these changes, these stresses, the pressure, how did that relationship, you know, like how did it continue? How did it evolve? How did y'all try to manage to deal with it all?
We had a lot of sessions where we all sat together and complained. People brought up unionizing. People brought up what kind of actions that we could do, but it ended up just, like I said, we were just atrophying, hemorrhaging people, losing people left and right. Some of them getting fired, a lot of them finding employers that were better. And yeah, I am still in contact with people there. I just got a text message just this past week from somebody who was basically like the department mom, just asking me how I'm doing at my new job and telling me that even more people have left. And just, my heart goes out to them, and I don't know what else I can do for them other than, you know, I always let them know I'm there to help them with their resume, help them as a professional reference, help them. I'll look up jobs and try and share them, and, you know, we all vouch for each other. But there was something that one of my coworkers there, who now works for a company that I don't work for, said to me that it really stuck with me. It was just like a message in a text message. But it was, no matter where we work, we'll all be on the same team. And that kind of solidarity, I think, is important to build. And I try and build those connections, even with people that I don't share any sort of political similarity to. It's, like I said, it's important to surround yourself with people who care about others, but also bridge those gaps when you can. Like my very best bro, my platonic friend, who I rank, you know, just under my wife in terms of favorite people. He when we first met, had some pretty objectionable views about different things. You know, wasn't anything remotely close to progressive. And like I said, he's my best bro now, and we absolutely have each other's back. And he has changed and learned. I have changed and learned, and you just need to make the effort. But it is hard. I get it.
I think the medical staff also, there is an aspect of it's bad for their health to have a work environment like that with their stress level and their need for the healthcare system to remedy the effects of their employment.
Absolutely. And honestly, hearing the message of like, no matter where we work, we're still a team, that's empowering. And I'm so glad that even through all those hardships and whatnot, that you, Evan, you and your fellow workers able to maintain that communication. And I really hope that, you know, things get better at that hospital, and I hope that things continue to be great at the hospital you're working at now. Thank you so much for sharing your story, and have a good rest of your night, my man.
Yeah, and similarly, I think...
Absolutely. Thank you very much for the opportunity, and this is a great event.
Absolutely. Thank you.
Similarly, I think with like the TikTok and a lot of people that have realized class consciousness more recently are saying
same thing.
Absolutely.
No matter where we are, we're fighting the system.
Absolutely. Our next speaker couldn't make it today, but was able to record his statement, and we're going to show a little video about that. This is going to be from a nurse's perspective, working in the U.S. healthcare industry.
Hello, I'm a registered nurse who's been working in the healthcare field since about 2016 when I graduated nursing school. I began my career as a bedside ICU nurse and have worked both as full-time staff and as a travel nurse to various areas through the Southeast. More recently, I have transitioned into a post-operative recovery unit in town as I recently became a father. My experience in the healthcare field is very typical of anyone who got into this field out of a compassion to help people through some of the most difficult stuff that they go through. I have, in the short time since I started nursing, witnessed many cases in which our for-profit healthcare system neglects and often causes direct harm to patients. These cases might be unique to me and those I work with, but take place often and daily around the country, and even more now that so much of our healthcare is business-driven and lacks true compassion or humanity outside of what is required to maintain the image of empathy to the public. Pretty soon after graduating and starting in my first position as a nurse, I began to see these issues and contradictions of our healthcare group pop up frequently. Why did it feel like all of the charting I did, which takes time away from patient care, seemed to be in the interest of protecting the hospitals from lawsuits and malpractice over the actual people in the hospital? Why is the management sector of the nursing field so bloated, which continues to get worse? And why are they seemingly uninterested in the working conditions that we face and only seem to serve as a barrier between the bedside staff, ancillary staff, and upper management? These thoughts began weighing on me while also having to process a lot of emotional life and death situations that you get used to seeing in an ICU setting of the hospital. During my first years, I worked in a large hospital in downtown Louisville, and we would often get some of the sickest and most neglected people in our unit. Many of these people were very financially at risk, unhoused, or otherwise disabled. I would work my shifts with these patients. I would hear the same stories about people not being able to afford their insulin, having to stretch their medication to the next refill, not knowing how to do the things they need to do to remain healthy, more often than not due to just a basic lack of understanding of disease process. The physicians, another set of people who are also victims of this vicious healthcare system, either did not have the time to help properly educate these people or simply did not care enough as long as the boxes they needed to check for rounds were done. The standard round is to walk into a patient's room, listen to their chest, ask about 2 questions, and then turn to leave. Many of them often not checking in with the nurses to get any kind of report or happenings that may be pertinent to their treatment of these patients. Many of these people will frequently end up in the hospital due to these failures of not just our healthcare system, but of our country as a whole when it comes to social support. So many of my patients just simply lack the fundamental resources and understanding that they needed to keep themselves out of the hospital, which in turn causes more stress and anguish to these people as their funds continue to dry up and they have to choose between medication that can keep them from having a stroke or a heart attack or being able to afford their next meal. And this is not just applicable to the poorest, but is also applied to people that consider themselves middle class, as everybody knows how quickly hospitals can eat through any kind of savings that people have. Working through COVID as an ICU nurse was both a traumatizing and radicalizing experience, as you were witness not just to the countless deaths and tragedies, but also to the strained healthcare system and what it prioritizes when the system has to deal with the added stress of a pandemic and limited resources. When the pandemic first began, not only was there a great deal of fear in the workers of the healthcare system, but there was an immediate rationing of resources that started with something that was paramount to nurse safety, our N95 mask. I was working at a hospital in Lexington, Kentucky, and while there we were given one mask and told to use it as long as possible, and were not given new ones unless management deemed it necessary to issue a new one to us. Not only was this a dangerous practice, as N95 masks do not stay functional for nearly as long as they required us to wear them, but also put our patients at risk, as we ourselves were unsure of what the best way to handle entering and exit infected patients' rooms were. While all of this was going on naturally, the higher up management and those who work in regulatory agencies stepped away from the hospitals, working from home and failing to protect the nurses and other healthcare workers when they needed these agencies to advocate for additional resources and materials that we would ensure we could do our jobs safely and properly. These issues, along with the general confusion and change of policy every few weeks, no doubt caused direct harm to those frontline workers who were in constant contact with the public. I've had the privilege to work in several hospitals in which we provided care for nearby incarcerated populations. One hospital I worked at during COVID around 2021 served as the primary hub for under or uninsured people in Nashville, as well as any incarcerated people who needed medical attention. The resources at this facility were very diminished, and this hospital was a public facility and therefore relied heavily on that to function. The care these patients received, while often done to the best of the worker's ability, was leagues below what someone who goes to a much more prestigious hospital or private institution would receive. During COVID, one of the biggest needs in the ICU was for dialysis due to the damage the virus was causing to the lungs and kidneys. There are multiple types of dialysis, but the most often one we ran on hemodynamically unstable patients is called CRRT, which is a continuous replacement therapy. And this is often ran by the ICU nurse in conjunction with other therapies to keep the patient stable, while also helping to mitigate renal damage and systemic damage from that. However, in this facility, due to the type of people we served, there was no CRRT machines available or allocated to them by the state. Instead, many of these patients would often be subject to standard hemodialysis, which is much more taxing on the body and oftentimes can result in patient organ damage and even death. However, without this therapy, they would not improve. Additionally, many of the prisoners who had come in would often be clinically in much poorer shape, as the prison would often wait until there were extreme signs of distress to act accordingly and get the patient to the hospital to be seen. These combination of factors, as well as the perception surrounding care for incarcerated people, certainly caused many unnecessary deaths and other severe bodily harm that could have been avoided if proper resources and timely assessments and treatment of these patients was performed both in the prison setting and in the hospital. Incarcerated peoples are one of the more obvious class of people who get unfair medical treatment, but even amongst the general population, the prioritization of profit over anything else can be seen. Staffing has always been a problem in hospitals for the better part of my career, and being a travel nurse who worked in hospitals with those needs, I can tell you that the main driving force behind the staffing issues stems from a business model that puts efficiency and maximization of profit over the workers. These large hospital chains have removed much of the human aspect of care from the hospital and pushed compliance and increasing workload on an already fatigued workforce. Most of this is distilled through management under the guise of necessity, but at the core of it all, the day-to-day budget of the units is nitpicked and refined, resulting in longer, more stressful hours for us, increasing patient ratios, charting, and constant surveillance by quality managers, assistant managers, charge nurses, and unit managers. I cannot tell you the amount of times we have had people sent home mid-shift due to budgeting just to have a huge influx of patients or a significant event in which having these people available to help could be beneficial. This often results in more burnout, less job satisfaction, and patient harm, as people and the workers feel constantly stretched in a workplace that looks at numbers in days instead of patients and workers. This is just a few of my experiences I could quickly recall. I could go on and on about specific instances that I've experienced, but the general point I would like to make with my statement is that the for-profit healthcare system is actively causing harm, not just to patients, but to workers as well, both mentally and physically. The only way this can be fixed is if we remove the business and the profit aspect from our healthcare system, which first starts with a reanalysis of how we have our society as a whole.
100%. It goes back to what was said before by Evan, is that at the end of the day, healthcare should not be looking at someone and viewing them on being on a data sheet, and that's the issue. Everyone whether they be workers or people trying to seek coverage, they're on a data sheet. They're not seen as people.
Right. Next up is Laura. Laura is an organizer for the Revolution in Anderson County.
And she'll be talking about healthcare in other nations versus healthcare in the United States.
Hello.
Hello.
First of all, we had a lot of really great speakers today who made a lot of really valid points, both from the healthcare perspective and as patients. The United States fails as far as healthcare is concerned and many other aspects, but we're speaking about healthcare. Statistically, when we're talking, and I'm going to use terms, basic terms that everyone can generally understand, the G7 countries, the developed countries. I don't like these terms, but it's terms we get. Statistics. Top 3 countries for healthcare: Taiwan, South Korea, Australia. Where does America fall? Want to guess?
I'm going to take a wild guess, probably 50th, maybe 100th spot.
Last in all the developed countries for healthcare. And this is this is based on the healthcare infrastructure, healthcare professional competencies, annual per capita costs, availability of quality medicine, and government readiness to address healthcare crisis. We fall last. All other countries that come above us include China, Norway, Iceland, Sweden, Switzerland, the Netherlands. U.S. ranks the last in developed countries. We have the most expensive healthcare, but we fall last when it comes to outcome. We have the lowest life expectancy of all these countries. We have the highest mortality rate when it comes to maternal and infant care. But Angie pointed that out. We also have the highest rate of avoidable deaths. Now what the difference is between those countries and our country is those countries have either universal or single payer health care. They take care of their people. In England, in the 1800s, there was a movement started, cooperative movement. In Rochdale, a group of women got together because their husbands were dying in the coal mines, and they couldn't afford to bury them before socialism hit England. So they got together and created a cooperative. They pooled their money together to bury their husbands. And this extended to other cooperatives, included grocers, but also included healthcare. And that's when they started springing off into, oh, healthcare should not. No, I don't have the numbers on bankruptcies because they don't have bankruptcies. When you don't have to pay for your health care, you don't have to go into bankruptcy for health care. In the United States, that's one of the number one reasons for bankruptcy is health care. That is one of the number one. It's like 6 people a day go into bankruptcy for medical health care, for medical expenses. But in England in the 1800s, almost 200 years ago, women who were starving to death trying to bury their husbands started cooperatives for healthcare. Healthcare should not be for profit, period, but I think we've come to that conclusion. Other fun facts. The United States, though we have the worst healthcare and it costs the most, we spend in our tax money 3 to 4 times more for healthcare than any of these countries that have universal healthcare. So the argument, oh, it's going to cost so much money for healthcare, for universal, it's going to cost too much. You're already paying that much, people. You are already paying way more than you have to. You will pay less when you're paying for universal healthcare than you are paying now in your tax money for Medicare, Medicaid, all these entitlement programs. You will pay less for universal healthcare. You will pay less for burying people, for keeping people healthy than all of that. So I'm on Red Note, because take a talk. Bye-bye. And one of the best jokes on there is that people ask, what are the jokes about Americans that you have in China? And one of the funniest ones, and I think it's hilarious, they ask us, Why do you eat like you have free health care? And it reminded me, so I had a friend who was Chinese American when I first started going back to college the second time in my 20s, 30s. I'm not going to talk about it. And I would take supplements trying to get healthy. And she said, why do you take supplements? I'm like, well, I'm trying to be healthy. She said, why don't you just eat what you need? And it started me thinking, why don't I just eat what I need? Well, because the food here makes me sick. Food in America makes me sick. And it was no more driven home to me than when I went to visit my sister in England 2 years ago. And I was there 48 hours. And my daughter, who was 12, 13 at the time, points out to me, Mama, you seem healthier. You seem like you're doing so much better. And then it occurred to me, their food there is better regulated. They don't poison you with their food in Europe. Here, the food is full of so much bad things for you. It's like a cycle. They poison us with the food, so we have to have the health care. So they profit off of us with bad food, and then they profit off of us with the health care. These corporations are profiting off of us dying and living with health care.
And working.
And working.
We are a farm.
We are a farm. We're being farmed. And it's a country built on slavery. We are still slaves. All of us. It's shown over and over and over again, and the government does not want you to see it, but everywhere else that has universal health care, whether it's single payer or public funded, and in other countries in Europe, France has both public and private insurance. You have government single payer health care, but you can still buy private insurance. Same in England. It is the same way. Other differences. In England, it is illegal for for pharmaceuticals to put advertisements on television. Why do you think that is?
Because obviously it's exploitative, it's predatory.
It is exactly that. It is predatory. Exactly that. Predatory. It convinces you, oh, you need this pill, and you go to your doctor and you get it. Or you try to get it, or you're going to get it because they're getting a kickback.
Mm-hmm.
It's a cycle of corporate predation. And they lobby Congress. Congress gets stocks. Congress gets lobbies. The Congress is getting paid forwards and backwards to not take care of you. And the Harvard or Princeton put out the graph that showed that if you have the money, they'll pass the law for you. If you don't have the money, everybody else, they're not going to pass the law. So that is the difference between healthcare here and healthcare pretty much everywhere else.
Absolutely. The most basic things that you would expect in America cost thousands upon thousands of dollars. Like I pointed out in my statements, like 3 crowns, the smallest things, no bigger than some erasers, that is now $5,000 in total, when in other countries, you mentioned China, and like in China, where they have these services and it's more publicly funded, it doesn't cost like that. It doesn't at any rate. But as you pointed out, it is, they make money off us if we're dying or living or if we're sick, because it's dialectical. It's all, they want us to be sick, because if we're sick and we're unhealthy, they make the money, but if we're alive, we can work for them and make the money. So either way, we're making the money, and it just shows how incredibly rotten the system is, and how it just ultimately affects all our lives, makes us all just worse off in general, and then other countries are just baffled by it, because it makes no sense.
Yeah.
It's a logical system, but the system is built off basically one group of people, those in the top, the owning class, making all that money, and they're going to make it either with live, dead, or sick.
The oligarchy, exactly. The oligarchy is going to make money one way or another.
Absolutely.
And until we get rid of it, it's not going to change.
Absolutely.
Any questions?
You too. Yeah. I think, thank you so much for talking with us, Laura. And, thank you. So,
I'm taking everything with me.
No worries. So our final statement of today is from a worker who worked at United Healthcare, and who has sent us a statement anonymously to read out to you. Hello. A few years ago, a 37-year-old with no health insurance and an ever-dwindling bank account I found myself suffering from a physical injury that would likely require surgery. A friend assisted me in finding a job that would provide me with adequate health insurance, and 1 month later I started as a claims adjuster for a major health insurance company that has been in the news a lot recently. You know the one. It quickly became apparent that while both quality and quantity were on the corporate checklist for success, the latter of the two was more important. In our training, people would celebrate the denial of a claim because they were very easy to process and we could meet our metrics standards in an expedited fashion. This happened quite often. On a normal day, a person in this job can process anywhere between 10 to 35 claims, and usually at least 25% of those are denied. That rate is bolstered by prior authorization, denials which, for seemingly arbitrary reasons, impedes doctors from rapidly and effectively treating a patient. What sense does it make that a doctor would need to obtain permission to treat you from someone who would profit from denying you that treatment? When these kinds of denials are overturned, it is often after a lengthy appeal process. I tried incredibly hard to get every claimant to pay. I scoured their contracts, explored exemptions and extensions, and gave them all the time that was allotted to me. What scares me is that some people would tend to forget that these are real people and not just numbers on the screen. People would forget this at the lowest level of the company. After this realization, I did not stay for very long and departed once I had healed from my surgery. And honestly, again, as this worker at this former worker at United Healthcare stated, every person, whether they be a worker or someone trying to get coverage, is viewed as data. They're not viewed as a person, and so it's easy for when someone gets denied and then people celebrate because, yay, I get my bonus or whatever that may be. But this has real impacts on people's lives. Healthcare is life and death, and if you can't get that coverage, you are risking everything. You're risking not only your life, but oftentimes the lives of others, because if people depend on you for, like, say, your income to get them to places, and if you can't do that because you're sick or dying, then what that means is that healthcare is not just affecting you, it's affecting everyone around you as well. And the fact that you have to fight so tooth and nail to even get through this appeals process just shows how much they don't want to pay and to do any coverage for people, and it's just so sickening. What's good to see in this statement, and something that I think is something we should think about, is that when we have companies like this that are very predatory, that try to target people and exploit them, brutalize them, there are people on the inside, the workers, who don't control that. They're there to get paid because they need money to survive, and this person, like many other workers, tries to do what they can to make sure that what they're doing is going to help someone. And I think it's very important for us to realize that when you encounter a worker at a company like this, it's not their fault. It's people at the top who make the policies, who own the company, that has caused this system to be the way it is.
Yeah, and auto denial claims too. Like probably 75% of claims never even get to them to deny. They're already denied. So,
Absolutely.
yeah.
But at the end of this live streaming event, so I think we're gonna give some closing remarks. You want to start us off?
Yeah, I think it's important just to recognize that we all have things in common when it comes to healthcare. It's not red or blue or third party. It's our neighbors, and we all are suffering under this specific thing. And that doesn't just apply to healthcare. It applies to our wages. It applies to our housing expenses. We have more in common than we do different. There is a system stacked against all of us, and that is one of the things that we have in common. And if we don't learn to work past the red or blue, we're never going to be able to have a fair healthcare system, to have food that's not poisonous for us, because they will always have the advantage. So instead of casting aside the rural people because they didn't vote your way, or casting aside the people in Louisville because they don't dress the same as we do in the country, we all don't have enough houses. We all don't have health care.
Absolutely. you know, we all have the same interests. You know, healthcare in the United States doesn't serve any of us besides, unless you're the person at the very top making all that money, it doesn't serve you. It's a system that's built upon trying to not only drain each of us for what we're worth, but then have us be almost viewing other people who do get covered as basically being our enemy because they got the insurance that we didn't, and that only further divides us. But this system of exploitation of predatory companies and the like, these can be challenged, and that challenge comes from, as it was reiterated several times, through having universal health care. Universal health care just or single payer for that matter, it completely just dissolves companies the ability to profit off our existence from needing to live. Because if you don't have health care on the table that's for profit, it could be actually used, healthcare could be used to help people as it's intended, not to make some other guy rich. And at the end of the day, as Jesse was saying, that understanding that we have those common interests, that we all need healthcare, means that we need to unite as a whole to fight for that, to organize for that.
We can make demands. If we're all on the same page, we can say this is our demand, and if you don't do it, we do this.
Absolutely.
And as a unit, you don't have to be in a union. I've never been in a union in my life, but that's how activists roll too. So as long as we're all on the same page, we can make demands anytime we want.
No matter where we are, we're a team, as Evan's friend had said. Thank you.
We're on Red Note now. That's a demand, you know? It's a demand, so.
Absolutely. Thank you everyone for watching this live streaming event. And, you know, if you I'll just reiterate that we have an educational coming up on Wednesday, January the 29th at 6:15 p.m. at the Highlands Shelby Library, where Kate Hill will be further speaking on the issue of healthcare and the working class. So if you're able to attend in person, we welcome you. If not, we'll have a video up on our YouTube channel for that. And if you are someone who maybe couldn't make the stream to the entirety, this video will be on Facebook, TikTok, and YouTube for you to view. Thank you, and have a good rest of your night.
Well,